My name is Silvia Wozniak, and I teach here for 25 years. I am also the internship coordinator for the biology department.
What is your experience with insulin and its pricing in the US, and is it close to you in any way? Like, is the topic close to you in any way?
It is really, really close to me for a couple of reasons. One of them is that my husband is a type 1 diabetic, and also we have a nephew that was diagnosed a few years ago with type 1 diabetes. Type 1 diabetics, they used to be called insulin dependent, and type 2 diabetics used to be called non-insulin dependent. That's an obsolete kind of use of names, because there are type 2 diabetics that take lots of insulin. The distinction that one is juvenile, the type 1 is juvenile, and the type 2 is adult onset, is also obsolete, because you have kids being diagnosed with type 2 and you have adults being diagnosed with type 1. You have type 1 being the ones that your pancreas does not produce insulin any longer. And type 2s are the diabetics that have resistance to insulin. So absolutely this topic is close to my heart, because I have it at home. The need for insulin, it's a drug that will keep the patients alive. And also because I worked for 25 years now in an endocrinology office.
When did you personally discover the sudden rise of insulin prices?
Well, as I said, in the office, we see situations with patients that one of the main conversations is cost. You are with a patient, the physician is with a patient in the examining room, and the biggest discussion is price. Doctor, I cannot afford my treatment. What can I do? Throughout the years, we've seen this pattern of increasing prices. It's not just the drug that keeps them alive, but you have so many additional costs. The patient usually is not only in one certain kind of drug, but several. The list of medicines is very long. Second, you need to have your glucometer, and you need to have strips, and you have little needles that will prick your finger for you to measure the glucose, the blood glucose. These days, thankfully, technology in medicine is advanced. You have what is called CGMS, Continuous Glucose Monitoring System. That is a piece of equipment that is costly. It's very good because, as the name says, it measures the glucose continuously. However, there is a cost. Insulin pumps, they're very good because they can keep your glucose levels in better numbers, better ranges, but there is a cost for that. So if the drug that keeps you alive keeps on rising in price, plus all the additional costs that you have, that's really life-threatening for the patient.
What are the different types of insulin, and how have they evolved over time?
So you have what is called the rapid-acting insulin. You have some examples here. So you see that's important, and it might be relevant for our conversation to see the big names. So Novolog, Novo Nordisk is one of the big manufacturers. So you have Novo, you have Lilly, and so the rapid acting insulin is the one that, as the name is saying, it's going to spike very quickly, 10 to 30 minutes. So the person is gonna eat a meal and you take that rapid acting, that it's a bolus to cover for that spike in glucose that you're gonna have. Then you have what is called the short acting, that's gonna be slightly longer, also taken before meals. And then you have an intermediate acting insulin, peak between 4 and 12 hours, will stay for 12 to 18 hours. And then you have the long acting. So people might say, oh, well, my blood glucose is so high, why I didn't eat anything? Well, our blood glucose has to be in a certain level throughout the day and throughout the night, even when you're not eating, right? So you need to have insulin being produced to maintain those levels of blood glucose. So the long-acting ones are the ones that will maintain those levels throughout the day. And then you have some that are ultra long and also the pre-mixed insulin. So you have something that is going to be long acting combined with something that is short acting.
We all know that insulin prices are currently extremely unaffordable for many people right now. And what are your thoughts on that?
If it's a drug that is keeping you alive and if you do not have access, that is very upsetting. As I said, conversations that should be around the well-being of the patient in most instances are conversations of affordability.
What do you think is the cause of the rise, if you were to pin it on anything? Like, what do you believe are the primary factors of its pricing?
Okay, so insulin prices in the United States experience significant increases between 2002 and 2013. The cost might be up to $900. And as I said, the variation, the monthly cost, the variation will be huge because you have the type 1 diabetics, they need a certain amount and types of insulin. And then because type 2 is such a big range of outcomes for the patient, you have somebody that will be treated just by diet and exercise, all the way to people that will be needing oral medication, some amounts of insulin or huge amount of insulin. So the variation will be very, very big in there. So the variation of cost will be very big. Regardless, they do need insulin. Reasons for that, right? We have 8.4 million people with diabetes in the United States, right? And they rely on insulin to survive. Okay, so those numbers are huge. It's a very prevalent disease. 85% of any endocrinology practice, unless they are specialized in reproduction, but the general endocrinology will be made of patients with diabetes. We did have efforts to diminish the price. However, the justification, as you ask me, what is the reason that the price went up? The justification by the pharmaceutical companies is that you need money for research to keep on advancing. However, personally, I don't know if pharma has any big interest in curing diabetes, because if you can have a drug that the person will need for life, why should you cure this disease? But that's my little side thought. So what they claim is that they need money for research. That's why the prices are so high.
What is the difference in prices of insulin between those who can afford insurance and those who can't?
You're gonna have a huge variation as well. So now you go into healthcare in this country, right? You do have Medicare, which is federal kind of insurance. You have Medicaid that is kind of dying, but it's also government at the state level. And then we have private insurances. Within that range, you have so many different plans, so many. It's not like, okay, we have 1, 2, 3, and that's going to be the cost. Within the private insurances, we have, let's say, Blue Cross and Blue Shield, we have thousands of different plans. So that cost will vary depending on what kind of plan you have. You have people that have very high deductibles, so they are going to have to pay more. They have people that have only a co-payment. There are people that have co-insurances, and those co-insurances will vary. And so it's not okay, that's the cost, period. And it fluctuates also according to the provider. If you have the same procedure done in one office and in a different one that belongs to a bigger hospital, for example, the cost of the same exact procedure will be different. So it's very variable, and you cannot say, okay, this is the price.
Yeah, there's no set variable, right?
Yes, and that's beyond insulin. That's a problem in the healthcare system. That is one of the most unfair things that I find. If you're doing something, if a doctor is doing something, the doctor is qualified, can be Dr. X, Y, or Z, that compensation should be exactly the same. You should not have variation. Yeah. There is no reason for that. So we had the Affordable Insulin Act that was introduced in 2022. and was aimed to limit the out-of-pocket insulin expenses to $35 per month, only for Medicare beneficiaries. So although the idea was to have private insurance and Medicare, the bill that passed in 2023 was just for Medicare.
So just for Medicare, no one without insurance, just only Medicare.
Without insurance, forget it. You're out of luck without insurance.
How do the prices of insulin in the United States compare to those in other developed countries?
Okay, so I have a little image for that. So we have American insulin prices are off the charts. You see the prices of United States compared with Canada, and that's one of the stores that we have surrounding our country, that people will go either to Mexico or to Canada, people from the United States, to try to get more affordable insulin. To fly to Europe, look at France, United Kingdom, it's a fraction of the price. It's really outrageous.
In your opinion, what could our country do to lower the price of insulin?
I think that, again, it's regularizing those prices. I mean, the cost, why the same drug can be cheaper in a different country. Why? If it's, I need to make something and give to the public, why in a different country that can be more affordable? What they are doing that we are not doing, right? Why it has to be so much more expensive here?
What would you believe would be the most promising strategy for achieving sustainable insulin affordability?
Again, I do think that's regularizing this and actually saying, look, that's how much profit. I'm not in favor of limiting profits. I think that, yes, we are in capitalism. We are for profit in many instances, right? So I'm not saying that, yes, we should not have profit. But for sure, because of the discrepancies, there is somebody that is having a much bigger profit than it should. So if we regularize those prices and make it fair and accessible, and we'll invest for diabetes as a whole, right? Insulin users are diabetics. An entire comprehensive action around the disease, right? As I said, insulin is one of the many things that diabetics need.